We have codes for insertion of pacemaker, and this pacemaker, if you see, it is called either as a single chamber pacemaker or a dual chamber pacemaker. What is the difference? It depends on the number of electrodes that is being placed. You know the chambers of the heart. If you place one electrode or one lead in the right atrium, it is called as a single chamber pacemaker. If you are going to place one more electrode in the right ventricle, it is called a dual chamber pacemaker. That is all the difference. And then the placement of these electrodes, right? We need to know the battery is placed within the body. Sometimes they also make a thoracotomy, right? And they might place a device within the body. Okay. In some other cases, what happens is they place the electrodes transvenously. Usually what they do, once a battery or that pacemaker pulse generator is being placed in the human body, in the cavity, placement of the leads take place via the veins. So this is called as a transvenous placement of electrodes. So you should be in a position to figure out whether it is a single chamber or a dual chamber or an upgradation. Sometimes they upgrade to they might also place a device or the lead into the left ventricle also. Okay, for that you might call it as an upgradation. Please understand the reason for encounter, why the patient has come. Has he come for the insertion, or has he come for the removal or for the replacement? Here is a little bit of confusion, especially with this cardioverter and this defibrillator or this pacemaker, because usually whenever we code for the replacement, we never code for either for the insertion or for the removal. In some cases, if you go through the CPT codes, when you are going to code this replacement, you might also have to code the removal of it, because that is also taking some effort on the part of the provider.